So this is a hip 90-90 or a shin box. We're kind of delving into hip mobility here, where having increased internal rotation of the hips is often quite helpful with low back pain. So there's a couple of ways to do this. I don't have the greatest of hip mobility, so what I'll need to do is raise up my butt off the ground. So depending on how good your mobility is, if you've got poor hip mobility, you'll need to raise up. If you've got good hip mobility, you can take this away and eventually, hopefully, sit on the floor. So hip 90-90, I've got to come into this position. So it's important that this knee angle is 90 degrees. The angle through my groin is 90 degrees, and my other knee is 90 degrees. I like to hold my hands. I don't really want this, and I can really feel a strong mobility squeeze through this left hip, the hip that is in internal rotation. You'll see that I will have a bit of compensation that I'm trying to laterally flex, and that really shows you what the immobility in the hip, the compensation that happens through your lumbar spine. So I'm in 90-90-90. I will then rotate over to the other side and get myself in 90-90-90. So same thing, 90 degrees through groin, 90 degrees through my other leg. I feel my right hip mobility is worse, so you might see that I'm compensating a lot more. I might hold that contraction for 5 seconds and then come back over into this position, and you can just go through each side. What I'll do is I'll take that away, and you can see the increased compensation that I will now need because I don't have that good hip mobility. I'm now laterally flexing over a lot more. This will get worse on this right side. You can see I'm laterally flexing, and that's the point of doing these dynamic hip mobility drills. They are the hip 90-90s.